Okay. Yep.
Yes, family doctor system.
Okay, so I'm going to talk about, we call it general practice, and that's family doctors. It's a system in the UK that is part of the NHS. It's a free service for people. In the area that you live in, you can register with a general practitioner or a family doctor, and they cover certain areas. They have boundaries and limits of how big their practice extends. So if you live in that area, you can register with that doctor, and in each area there probably are several doctors that cover the same area. So you choose which one you register with, and if you are somebody who was born in the United Kingdom, you can go to see the doctor freely. We tend to open at about 8:30 in the morning until about 6:30 at night. And throughout the day there are a variety of different appointments. So you book to see the doctor. So normally at each practice there may only be one doctor, there may be several doctors, and you book an appointment to see them. When you see them, you have a 10-minute appointment, and you can ask about whatever your problem is, and they will give you advice. As part of the system, usually in each doctor's surgery there are nurses who work there who will do things like take bloods and take smear samples, cervical smears, and sometimes there's people called healthcare professionals who also take blood and do heart tracings, ECGs and things. So that's a bit about how it works. Usually they're open Monday to Friday, and then they're closed over the weekend, and then the service is run by an out-of-hours provider. So that's people where you have to go to a different place rather than your doctor's surgery to be seen by a family doctor. So you can choose to do that work or not, but otherwise the hours are roughly, as I say, about 8:30 till 6:30 Monday to Friday. Some doctors do work on a Saturday morning, but it depends. It's not everybody does. So you were talking about what the merits of that system are. So the things that are good about it, it's people can come to see you, and it's free, so it doesn't cost them any money. So if they're ill, they can come, and also people who are on benefits or earn less than a certain amount can also get their medicines free. They get free prescriptions, so if you do them their tablets that they need, they can get those free. So that's a good system for people who haven't got very much money. The problems with it are that if people book an appointment and they don't come, then obviously that's wasted your time, and somebody else could have been seen in that time, but obviously there's no penalty. You can't make them pay because it's a free system. So that's one problem sometimes with it. It's a very wide-ranging thing because people can come with any problem, so you have to know about lots of things. So you have to know something about medical things, surgical things, pregnancy-related things, children things, ear, nose and throat. So it covers everything possible. So you have to be very general rather than a specialist, and sometimes you don't know what the right answer is. Then also, I suppose the other problems with it are you have to, if somebody's unwell, you have to refer them into hospital, and it's kind of bridging the gap for that. And then obviously some of the people that you care for at home. The other thing that the job involves is we go and visit people in their homes. So people who aren't well enough to come to the surgery, we go and visit at home. So most doctors, what they would do would be do a surgery in the morning, then perhaps some telephone calls to people, and then go out and visit one or two people perhaps at home who are too poorly to come to the surgery or not able to get there for whatever reason. Then go back, perhaps do some paperwork, and then do another surgery in the evening, and that will be how it works for most people. So part of the job is, seeing people in their own home, so you learn a lot about sometimes how people live, and that's, that can be very insightful and helpful. You also, as a family doctor, perhaps get to know the patients very well. Whereas as a hospital doctor, you just see them for a short period of time and then they go back home and you don't know what happens to them. Whereas a family doctor, you can get to know them and their family members. And some family doctors have worked in the same place for 40 or so years, so they know everybody in the community and you're a real person within the community. So that's something that some people like, some people don't like, but I think it is nice because you get that continuity of caring for people. And then I think you also, if you stay in the same place, you build up patients who you see over and over again, so you know them very well. But sometimes that can be a negative thing because you think you know everything about that person, but actually sometimes you can miss obvious things because you see them lots and lots. So I think that's one thing. Do you want to stop it a minute?
Okay.